Welcome back to KTN News Weekend Prime. Now, after the announcement that a man who suffered erectile dysfunction for years now has his groove back, questions have emerged, with most wondering how the surgery was done, the material used, and the available options as far as implants are concerned. The patient in his 40s had used other treatment methods without success. Now, these tests conducted on him included a penile Doppler ultrasound, showed that he had severe venous leakage, thus necessitating the use of an implant. KTN News Health and Science reporter Agutu Rosa spoke with Dr. Ahmed Youssef, a consultant neurologist who was the lead surgeon during the procedure.
The announcement of the successful surgery on a man who suffered erectile dysfunction for years has caught the attention of men and women alike. Some are looking for ways to get the surgery, while others are recommending the same for their partners and friends. But there are also those who are just curious to know how this was achieved. Dr. Ahmed Youssef is a consultant urologist who was also the lead surgeon for the groundbreaking procedure, says that it was the first of its kind in East and Central Africa and involved implanting a prosthesis device in the man's penis.
It is a special type of alloy. Alloy, this means that it is a lot of materials. It is mixed together to have this alloy, which have some metal components, and so it will give this rigidity of the penis.
There are different degrees of erectile dysfunction. Some require injections while others call for surgery. Dr. Ahmed says the recent surgery also helps in maintaining an erection even after ejaculation, but advises men not to abuse that unique feature.
For this, we are advising our patient after fixation of this penile prosthesis to have a regular sexual life with the normal sexual way without any abuse for this penile prosthesis.
There are two types of penile prosthesis: the malleable, also known as the non-inflatable penile prosthesis, and the inflatable penile prosthesis. The malleable prosthesis requires the patient to direct the penis by his hand. They simply bend it up for an erection and down when done. Dr. Ahmed says that the inflatable is more natural because there is a reservoir that is pushing fluid to the penis to cause the erection, and after the intercourse, all the fluid comes back to the reservoir. According to the U.S. National Library Medicine National Institute of Health, the inflatable prosthesis consists of a pair of cylinders implanted in the soft tissues and is connected to a pump. When the pump is squeezed and released several times in a process also known as recycling, the cylinders are filled with sterile normal saline, simulating a normal erection. But before this kind of surgery is undertaken, doctors usually consider several things in the patient's present and past medical history. They include the patient's age, the size of his private organs, and other factors. They also need to know if the patient has had any forms of implants, deformities around or diseases around his penis. Previous surgeries around the colon and prostate are also looked into. Apart from the surgeries around and within the reproductive system, doctors also need to know if the patient had previously had abdominal and bladder surgeries, the patient's body type or his present and previous conditions or conditions that affect the penis, like fibroids, penile curvature, and the presence of prominent suprapubic fat are also factored. Doctors also need to know if the patient has undergone male circumcision. Dr. Ahmed says the surgery lasts an hour and the healing process takes 1 week. However, the patient should wait between 4 to 6 weeks before engaging in sexual intercourse.
This material is different from which type of the penile prosthesis we are implanting, because we have two types of the implants. Number one, it could be the malleable, that the patient is directing the penis by his hand, and there is another type which is called inflatable penile prosthesis. It has a normal erection and normal flaccidity by a sensor who are putting, or a valve who are putting in the scrotum, so accordingly the material is different.
Dr. Ahmed says causes of erectile dysfunction are stress, obesity, diabetes, hypertension, and cardiac problems. Another problem is a penis leakage, which he says is suffered by 15% of patients. Another procedure for men is penile enlargement for those who are not satisfied with the volume and length of their reproductive organs. Dr. Ahmed says that there's a normal size of penis that is suitable for intercourse and pregnancy. But if it is below that, then there's a procedure that is recommended.
A normal measurement and normal size for the penis, the flaccid penis and the erected penis, which is suitable for the intercourse and also suitable for having a pregnancy. If there is an issue in this size, okay, in flaccid or erected penis. In this time, we are planning to do some enlargement procedure.
The procedure entails removing part of the hand's skin and muscle and fixing it in the penis. But this procedure is not common because most men are comfortable with their volume and size. Agutu Rosa, KTN News.
All right. Now, a school bus driver was killed and 13 students